But there are reliable sources of information. There are people that are trained to analyze the scientific literature, who know how to analyze that scientific literature. They've gone through decades of training and experience in analyzing and understanding scientific research and the biases involved and the strength of studies and so forth. Those groups that we have traditionally relied upon, consensus scientific bodies of medical and scientific experts that are relied upon nationally or that have some, very diverse panels of representing multiple universities and, academia and so forth, and again, are very trained in these topics, are generally reliable sources of information. And so those scientific bodies, so the ones, for example, that advise different medical groups, so the scientific bodies that advise the American, College of Obstetrics and Gynecologists, or the maternal fetal medicine groups, or the American Academy of Family Physicians, or the American Association of Pediatrics. They have scientific bodies established that have been operating for decades, providing medical guidance that our medical community relies upon because they know that information has been adequately vetted and really analyzed with a microscope. And there are similar bodies like that at the national level that are advising the FDA, that are advising the CDC, that are advising other NIH and so forth. And so I think it's really important to understand that these aren't just, random doctors in Indiana standing up and talking. And while those medical professionals should also be listened to and considered and analyzed, there is some validity to when you have consensus statements being made by large groups of scientific medical professionals who have decades of experience analyzing scientific literature. So I would suggest those are more reliable sources of information, and governmental public health bodies like our St. Mary's County Health Department, or Calvert County Health Department, the state health department, the CDC, and so forth, tend to rely and gather their information from those scientific bodies. And so if you're comfortable hearing messages from governmental public health bodies, that's what we rely upon, that information. And then we try to digest it into language that is clear and understandable for the non-scientists in the community to understand. And so for those of you who are residents in St. Mary's County, you can certainly follow our St. Mary's County Health Department. We message quite a bit. We share messages quite a bit. We talk quite a bit about COVID and the science behind COVID. And you can gather that information from our website, from our social media platforms. And then also I go in front of our Board of Health, our county commissioners, every couple of weeks usually, where I also talk and answer questions. And we also have a COVID hotline that we operate on a daily basis. For Dr. Polsky will add more, I'm sure, but the other, the other source, I think, of medical information are the physicians and nurse practitioners who are your primary healthcare providers that you have gone to and get advice on about health for so long. Now, these are individuals. They may have differing opinions and understanding of the current scientific literature, but they are there and they care about you and they know what your medical background is. And they have a vested interest in keeping you healthy and providing you with sound medical advice. So those are also resources to look to for such medical advice.
That was pretty comprehensive. So the only thing I would just emphasize what Dr. Brewster said at the end, which is that for two reasons, that talking to your personal physician, nurse practitioner may be the best thing for you. One is that the messages that come out of agencies such as the CDC, I certainly will say is factually correct, but sometimes the language is a little bit confusing sometimes. And the other is that language that is from expert organizations, by nature is going to be somewhat generic. It's not going to really address the specific combination of health factors that any one person has. And so in order to get that level of personalization, talking to your personal physician or nurse practitioner is going to be the best way. And as Dr. Brewster said, that trust really underlies all of this. And I would hope that for everyone who's taking part in this call, that your personal doctor, your personal nurse practitioner is someone that you feel you can trust and whose health is paramount in any answer that they would give you.